If you have low back pain, you know the pain can be intolerable, but there is hope. On today's show, I will share ways to help you manage the pain, as well as always, answer your questions. All that and more coming up on this episode of Ask the Doc. No appointments needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, and welcome to Ask the Doc, No Appointment Needed, the show where doctors and medical experts will answer your questions. I'm Dr. Georgiy Brusovanik, a board-certified minimally invasive spine surgeon, and thank you for joining us today. Let's get right to our questions. Our first question comes from Alan, who emailed us, and he writes, "Hi, my name is Alan. I'm 68 years old. I used to be a power lifter and a bodybuilder, and I've got a lot of back, spine, and shoulder problems. The pain is on my back, up by the neck, and also the lower back, as well as the middle of my back, and also the right shoulder. I'm a mess. Looking forward to hearing your answer." I'm sorry, Alan. It sounds like you have the most common constellation of symptoms. And let me see if I can piece this together. If your neck pain is associated with shoulder blade pain or pain deep to your shoulder blade, if you have pain going to your arm, and if you have a stiff neck, then this is likely coming from a cervical disc, likely C5-6 and C6-7. If on top of that you have pain when you sleep on your side, pain when you reach overhead, as well as pain when you reach behind in the car, for example, then you have developed a tight shoulder, and about 80% of patients who have a neck problem will develop a tight shoulder or adhesive capsulitis, if you want to have a fancy name. Now, adhesive capsulitis is actually the more problematic area because that problem self-perpetuates. The more painful you are, the less you move your shoulder. The less you move your shoulder, the tighter it gets. And the tighter it gets, the more pain you have. So it's very important that you address your shoulder. When it comes to your neck, you need an MRI. It's that simple. If you obtain an MRI and you prove the diagnosis, then the options are going to be an epidural steroid injection or, in the absence of any severe deformity, disc replacement. Now, when it comes to your lower back, this problem is common as well. And I hope, Alan, that you're not blaming yourself in your years of sports participation. There's very little evidence, very little good evidence that physical participation accelerates your lower degenerative changes. Now, all my athletes think that the reason why they're suffering is because they play so hard, but that's not necessarily true. So when it comes to your lower back, if sitting hurts, if you're having to fidget in the car, if when you get out of the car, you have to stand up like an old man, takes you a while to stand up straight, and then once you start walking, you warm up and you're good, then once again, you have the most common constellation of symptoms, usually stemming from a degenerative disc. If you tell me on top of that that the pain goes down the back of your thighs, or the side of your thigh, down to the leg or the foot, then you literally have the textbook version of these degenerative symptoms. This is usually not a dangerous problem, Alan, and if you obtain a neck and back MRI, I'm happy to review and send you an opinion. But most of the time, patients with these symptoms can avoid surgery with proper conservative care, such as, in my hands, the most reliable epidural steroid injection. Don't rush into surgery until you've proven to yourself and to your surgeon exactly where the pain is coming from. I hope this helps. Our next question comes from Jordan, and he writes, "I'm 21 and an athlete, and sometimes I get pain in my lower back that is really severe. I've gone to doctors who have given me different diagnoses, but no one can figure it out because it's sporadic. Any thoughts?" Great question, Jordan. I'm sorry you're dealing with daily back pain. Unfortunately, you're not alone. So before I answer your question, I want to play a short video from Mayo Clinic that discusses dealing with back pain. Check it out.
Got back pain? You're definitely not alone. The majority of the population, the overwhelming majority of people will experience back or neck pain at some point in their lives.
Dr. Mo Biden is a spine surgeon at Mayo Clinic and says there's a reason so many of us have back problems.
There's many joints in the back, and each of them can degenerate and can cause pain. In addition, as we age, we utilize our back and our neck more and more.
Dr. Biden says pinpointing the exact source of the pain and finding the best way to fix it can be tricky, but not hopeless.
Generally, something can be done to help, and usually starting with non-operative measures.
He says in many cases, ice packs, heat packs, physical therapy, or injections can take care of the problem. Other times, surgery is the only thing that can alleviate the pain. But Dr. Biden says you do have some control in avoiding back problems.
Strengthening of the musculature around the back, those are important areas to help prevent back pain and to help slow down the rate of degeneration.
For the Mayo Clinic News Network, I'm Jason Howland.
That video had some good suggestions. Dr. Biden talks about how there's always a cause, and there is. And he also talks about the joints in the back of the spine. But unless you're a golfer or a baseball player, actually, in a 21-year-old with back pain, you got to consider a condition known as spondylolisthesis, where there's a congenital deformity that accentuates as the discs degenerate. Don't let this stress you out. This is not a dangerous problem. But Dr. Biden is right also about needing a diagnosis. So I would really encourage you to obtain an MRI of your lumbar spine. And again, if your doc is not giving you proper answers, then I'm happy to help. Here are eight tips to help ease back pain. So strengthening your core muscles. Dr. Biden mentions that in the video. That sounds really complicated. Core muscles. Just say abs. You got to get your abs toned. And I don't care if there's an 8-pack or a 6-pack or a 4-pack. The muscular tone has to be there, because think of your spine like a mast. You have to have a pool of lines in both directions, both towards the front and towards the back. Your lumbar musculature is very strong, and it will pull you towards the back. So you need your abs to balance it out. So do your abs. At least do leg lifts while laying down. It will make a big difference. Avoid sitting with bad posture. I really don't agree with that. Your posture comes from inside. So the reality is that if you have bad posture, it's because of something skeletal. If you try to force your posture into the right position, you may just fatigue and then have more pain. So I'm not saying that the advice, don't slouch, is wrong, but just stop blaming yourself for your bad posture. Take walks. Great. If you don't have stenosis, walking around, moving around is a great idea. And if that alleviates your pain, that's an easy solution. Lifting correctly is important too, because if you bend over and lift a bunch of weight, you put a lot of pressure on the lower discs in your back, and that may actually increase your risk of getting a disc herniation. A lot of my patients say that that's how their pain started. So lift by bending your knees. Reduce pressure on your back when you sleep. All right, well, the reality is that putting some pillows under your knees is a great idea when the nerves are on stretch and you get that severe pain going down the legs. But there may be a limit to how much that can help. Watch your weight. Okay, that's a good comment, but unless you have suddenly gained a lot of weight and that was coincident with the onset of back pain, don't blame your weight. Your back pain is coming from inside, usually from the discs or from deformity between the bones, not your weight. And this last one is 100% true. You got to quit smoking. Hypoxia from the tobacco displacing oxygen, as well as the tobacco itself, has been shown in numerous studies to have a very negative effect on disc health. So really, don't smoke. Next question is from Rhonda. She's following along on Instagram, and she writes, when it's overcast and about to rain, my back seems to hurt more than usual. Am I onto something here? Is there any connection between weather and back pain? Rhonda, I hear this question all the time. And I'll tell you, usually that complaint is associated with some degenerative changes. But what's the underlying cause? What's the connection between the weather and your pain? I'm sorry, I don't know. I don't know. I'd love it. I'd love to find out, and I will definitely research this issue. Perhaps we can touch base on the next episode. I'm sorry I couldn't answer you in detail, but it is something common, so don't think it's something very dangerous. All right, we're just getting started. If you have questions, here's where you need to go to submit them.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
We just got an email from Sherry, and she asks, my doctor told me I need to have a spinal fusion, and he said, don't worry, it's fairly common. It sounds serious. What exactly is it, and is it safe? All right, that's a really good question, Sherry. So fusion is probably one of the most common operations that's done in spine surgery. I would say it's probably the most, if not one of the most overdone operations. So the goal of fusion is to have the bones of your spine knit together. So the idea is if you have a deformity or the bones are crooked in relation to each other, you can remove the disc, replace it with something that will provide immediate stability, connect the bones with screws and rods, and voila, when the bones knit together, your pain is gone. The reality, however, is that with the new minimally invasive techniques, the recovery from fusion has become a lot shorter, a lot less painful, and the frequency with which this operation is done has gone up through the roof. The truth is, we as surgeons all know that when a disc is degenerative, there aren't a lot of options. When the disc has lost its height, when it's starting to impinge on the nerves, then you have to remove the disc, but then what? And the newer generation of spine surgeons are doing disc replacements, meaning instead of losing motion at the pathological segment, you replace it with a mobile device, and then you maintain motion. Now, why is that so relevant? Well, think of a tree that's leaning over a brook. If you don't bring that tree upright and you just hold it back, it will keep on leaning above whatever rope or other fixation device you have it being held. But if you straighten out that tree, you stop the lean. If you fuse a segment of the spine in a forward flexed posture, 36% of patients will come back and have to have more surgery. You see more motion above a fused segment. So reliably, the adjacent segments will degenerate faster. With classic spine surgery, this was very common. With a newer approach, that rate went down from 36% to about 3%, but it's still not negligible. Now, if there's deformity, a disc replacement just isn't possible. But since I haven't seen your images, Sherry, I would really advise you to talk to your doc and ask him or her whether disc replacement is an option. And if your doctor poo-poos disc replacement as something sort of unresearched, or if they come up with one of a number of other reasons not to do it, please get a second opinion. I hope this helps. We have another question that came in, and this one is from Randall. I love to work out, but it is starting to get really painful when I'm at the gym, especially in my back and neck. Should I push through it, or do I need to get it checked out? I don't want to stop working out, but I don't want to get injured either. Randall, so you sound like an athlete, and as an athlete, you probably know pain pretty well. You probably have learned to ignore a lot of pain and stiffness that you sustain after exercise. Well, when it comes to musculoskeletal pain that starts from your discs, when it comes to real neck pain or real low back pain, if you ignore that pain, it will pay you back. So I would address your pain first before you jump back into sports full force. I hope this helps. And listen, to all of you who have submitted your questions, there have been so many. And if your questions do not get answered today, you can always go to our website and click on Ask Hanna. There's a link. There are nurses available to help. And here is more information on how to reach to that link.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.
Our next question is from Tyler. Tyler asks, I hurt my back and went to the ER, and the doctor ordered a CT scan. I followed up with a primary doctor who wants to schedule an MRI. Why the different tests? Tyler, I'm sure so many patients have this question. CAT scan is just for bone. So it's often ordered in the ER to rule out something dangerous like a fracture. But really, when it comes to back pain or neck pain for that matter, you want to look at the soft tissues, at the nerves, at the discs. So an MRI is a much better study. And also, an MRI doesn't have any radiation, so little harm can come from that study. I hope I hope I answer your question. If you have questions, we have answers. Here's a way to send the questions to us.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
This next question comes to us from Ben. Ben writes, my friend and I have similar back issues. He has been doing research and mentioned stem cell therapy. Does it work or is it more hype than hope? Ben, I'm going to get crucified for this because the stem cell industry has become tremendous. There are no clinical applications of stem cells that have evidence-based medicine behind them. The studies are biased, the few studies that are available, and there are really no large studies with good statistics. Stem cells are not ready. We're learning how to control stem cells, how to make stem cells develop into cell lines that are missing or that are pathological. But as of today, those mechanisms are very few. There's a company out of Jupiter, Florida called Cytonix that are looking at slowing down cartilage degeneration by stimulating certain stem cells with your own humoral mediators. But just taking stem cells from the umbilical cord, from your fat, or from the refrigerator and injecting them into your knee or even worse into your spine, I really don't think it's indicated. And the fact that that everyone's a candidate, especially abroad, should really raise a number of red flags. There's very little oversight. I would not do it. Okay, our next question comes from Angie. I've had back pain for years and I've just dealt with it. But lately it's been more constant. Now, how do I know when it's chronic back pain or when it's become something more serious? Well, look, Angie, chronic back pain is serious if it's interfering with your quality of life. Chronic back pain deserves a diagnosis, an MRI, a physical exam, and a proper conservative evaluation. Now, when is it serious, as in when is it a red flag? When is it something that you gotta check out? Well, weight loss is a concern, especially unwanted weight loss. Incontinence is a concern, like when your groin becomes numb and you start to leak urine or even worse, bowel. Severe pain going down the leg with leg numbness or weakness is also a concern. And that's usually the thing that brings patients into the office. I personally can tell you before I had my surgery, when I had that severe leg pain, I couldn't take it. My mood was affected, my ability to think. I couldn't play with my kids, I couldn't work. So if you're suffering with pain going down the leg, I can definitely commiserate with you, and I'm sorry that you're suffering. One last thing I just want to mention, that if your pain comes and goes and you're wondering, well, when do I go see a doc? Go see a doc. There's no reason to suffer. Back pain is not different than knee pain or hip pain. There's no one that wants to have back pain. And if you're suffering, then you deserve a diagnosis and you deserve a treatment. All right, I hope this helps. This next question is from Jerry. Jerry writes, I see a lot of treatments marketed for back pain. Do any of them really work? That's a great question, Jerry. It's hard to generalize. So if you were to go on the National Institute of Health website called PubMed, you can see real evidence-based medicine, articles looking at a number of treatments. If an article is published with very favorable results that aren't reproduced anywhere else, if that article was sponsored, or if the authors of that article are paid consultants, you can take that article and rip it up. It will be reliably a very positive study, and why would they publish it if it was negative? And it's just not reliable. There is, though, good research, and there are treatments that work. So when it comes to back and neck pain, what works? Number one, time. Time works. As you know, many patients who suffer get better, get worse, get better, get worse. And if you wait through the acute episode, most of the time, the pain will disappear. The second is surgery. Surgery works. If you have a proper diagnosis, then you can address the problem, sneak in and sneak out. And usually that means waking up and the pain is much, much better or gone. The third option, the option that I prescribe for most patients when we just meet, are properly targeted injections. Now, these serve two purposes. One, an injection confirms the diagnosis. If I think your pain is coming from the back of L4-5 disc, and we inject a drop of lidocaine, and your pain goes away immediately, then it confirms that the pain indeed came from that level. Usually, the injection is a mixture of a local anesthetic like lidocaine and a steroid. So if we do hit the right spot, the steroid is the active ingredient. It will minimize the inflammation. And then that's the thing that gets most patients better. So don't let anybody rush you into surgery. It's extremely rare that you have to have surgery. If you meet a doc and he says, why waste your time with injections? It's all temporary. Run. Get a second opinion. Don't ever rush into surgery. Even if you're stuck in the hospital, you always have the right to ask for a second opinion. If you can't get one, call me and I'm happy to provide you with one. Okay, next question comes to us from Andres. Hi, doc. Quick question. Which is better for back pain, ice or heat? Can you explain why? That's a great question, Andres. It's a very common question. Look, heat brings in blood flow and it helps with healing. Ice decreases blood flow. So if there is inflammation, ice will minimize that. Neither one should be on the skin for more than 20 minutes to avoid burning the skin. But if you are having to apply an ice pack or a heat pack to your back or neck every night, you need something else. You need a diagnosis. You need to know why you are suffering. It's the only reasonable, rational thing to do to get to a point when you can stop using crutches and ice packs and heat packs and get back to normal, pain-free life. Normal life is free from back and neck pain. And I'll tell you, just today, I mean, every day I see patients like this. Usually it's a mom. And I ask her, do you go back to pain-free between your episodes? And she hesitated. And reliably, I knew why she hesitated, because like so many other moms, she lives in pain. I said, is this pain very severe? And when it's not there, you go back to your usual pain? And she kind of smiled and said, yes. And I said, well, how long has it been since your last day with actually no pain? And she started to cry. And it was hard to hear that this person, a young person, has been in pain for all these years. If you are in pain, you need a diagnosis. You need to find out exactly why you're suffering, because in 2025, it's a good time to be a spine specialist. It's a good time to be a spine surgeon, because I can actually help. I can actually take away your pain. So don't let the pain drive you nuts. If you're suffering, get a diagnosis. Our next question is from Cody. I'm in an office and sit at a desk all day. At the end of the day, my back really hurts. Should I look into getting a standing desk? Wouldn't standing all day hurt my back the same way sitting all day does? It's a great question, Cody. Look, a standing desk is another crutch. A lot of patients like it because sitting with, especially with a forward flexed posture, actually elicits pain from degenerative discs. So if you stand, a lot of patients say that their pain will dissipate. But a lot of patients will also say that when they stand for too long, they have to sit. So if you're having to constantly switch between sitting and standing, then at the risk of sounding redundant, you need something else. And you know what I'm going to say? You need a diagnosis. You got to know why you are suffering. And if you're having to adjust your life, then you got to ask yourself, overall, are you losing the battle? You know, before I had my spine surgery, I went to my daughter and I asked her, how often am I in pain? I'm a real positive guy. You know, I feel like I wasn't really living in pain for all these years. I would get an epidural every year, but I felt like in between the episodes, I was pretty good. And she said that 60% of the time, I was looking for excuses not to do stuff. So it was a jarring thing to hear. I feel like I'm an active person, yet it was clear that I was losing the battle against back pain. I was losing time in sports. I was losing time with my kids, and that's just unacceptable. And we have options. If you are in pain, you need a diagnosis. I really appreciate all the questions. Today, there were so many questions that I think can answer the same concern for so many people, whether it comes to the type of imaging or the cause of your pain. Don't hesitate. We are here for you if you'd like to submit your questions. And if you are feeling like you're being pressured into surgery, please, if you are not getting the answers that you're looking for, get a second opinion. See you in the next episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.